In healthcare, having a positive, life-changing impact on people who need it most isn't just in the hands of doctors and nurses, but a wider team of multi-skilled and passionate professionals. Introducing our Allied Health Professionals, or AHPs as they are more commonly known. There are many different AHP roles, each with a particular focus, such as physical, emotional, and psychological elements of well-being. AHPs are involved at all stages of patients' care, including assessment, diagnosis, and treatment, all with the aim of improving their quality of life. Here at Cumbria Northumberland Tyne and Wear NHS Foundation Trust, our AHPs work in a range of settings providing care across the whole northeastern Cumbria. AHPs work in hospitals, community services, as well as delivering care to patients at home or in a care setting. In addition to working alongside and supporting patients to live the fullest lives possible, there are many other benefits too, such as a rewarding and valued role in healthcare, excellent pay with clear route for progression, ability to step into a role straight after qualifying, opportunities to work in varied settings and with a range of patients, including children and young people, older people, adults, and specialist care. Opportunities to specialise and step into leadership, education, or advanced practice. At CNTW, we have a range of disciplines and are always looking for talented and enthusiastic staff to join our teams. You could join us in one of these interesting and dynamic roles. Art therapy is a form of psychotherapy used to help service users to explore a range of issues such as emotional, behavioural, or mental health difficulties, learning, or physical disabilities. For example, as an art therapist, you could be working with people who have a speech and language difficulty, or with individuals that are recovering from an addiction. A drama therapist uses role-play, movement, and storytelling as a medium for psychological therapy to help people explore and solve personal and social problems. Drama therapists are enabled to explore a range of different issues and needs, from autism and dementia to physical or sexual abuse and mental illness, to develop psychological, emotional, and social changes. Music is used creatively to help service users to address social, emotional, or physical difficulties. For example, you could be working alongside individuals with brain injuries, Alzheimer's, children who have experienced emotional trauma, and those affected by substance abuse and chronic pain. Dietitians interpret the science of nutrition to improve health and treat diseases and conditions by educating and giving practical, personalised advice to clients, patients, and carers. Dietitians aim to promote health awareness and prevent diseases in individuals. Occupational therapists support individuals to restore their independence and to overcome barriers that prevent them from doing activities that are important to them. OTs assess and treat individuals of all ages, ranging from children, adults, and elderly people, experiencing difficulties during their daily routines due to mental and physical health conditions. A physiotherapist is a professional who aims to restore and improve movement and function when a person experiences injury, illness, or disability to help them regain independence. Physiotherapists work with a variety of age groups who experience a range of health conditions affecting the brain, heart, lungs, bones, joints, and soft tissues. The focus is to facilitate a person's rehabilitation through movement and exercise, promoting their overall health and well-being. A speech and language therapist provides support for children and adults experiencing difficulty with speech, language, voice, communication, eating, drinking, and swallowing. Speech and language therapists help people with a variety of conditions, including developmental difficulties, neurological conditions, learning disabilities, stammering, and swallowing difficulties. The requirements for each profession differ, but generally most AHPs complete an undergraduate university degree. There are also new and developing routes such as apprenticeships. Undergraduate degrees usually take 3 to 4 years, and postgraduate degrees or masters usually take 2 years. Apprenticeships for allied health professionals are still fairly new, but more and more are being developed. CNTW will be offering apprenticeships in occupational therapy, physiotherapy, art psychotherapies, dietetics, and speech and language therapy. As well as registered AHP roles, there are also a range of assistant roles available within healthcare, such as Occupational Therapy Assistant, Dietetic Assistant Practitioner. Training to become a registered AHP could be something to pursue in the future should you enter the profession as an assistant. To find out more about our exciting AHP careers at Cumbria Northumberland Tyne and Wear NHS Foundation Trust, take a look at our website below.